Thanks for holding this critically important hearing. As I was preparing for this, I noticed in my biggest county in my district, they have a yellow alert up for opioids. They had 2 overdoses, an average per week in Jackson County, Oregon. They had 7 last week. Fortunately, no deaths. But first responders administered naloxone in Jackson County 5 times last week. They believe that it's probably heroin with a pretty heavy dose of fentanyl in it. So the deadly scourge continues. For many years, as you've heard, the Energy and Commerce Committee, and this subcommittee in particular, has been at the forefront of congressional efforts to address the opioid crisis and substance use disorder issues. And we've done a lot of work on prevention. We know we have a lot more work to do. This committee's held hearings and conducted investigations on opioids and the opioid epidemic for nearly 2 decades, from bringing in Purdue Pharma to testify in 2001 about the abuse of OxyContin, to our bipartisan investigations last Congress into the rise of fentanyl, opioid manufacturing, opioid distribution, and the substance use disorder treatment industry. These early hearings helped inform our legislative work, including the Comprehensive Addiction Recovery Act, or CARA, the 21st Century Cures Act, which authorized the state-targeted response to the opioid crisis grants, and billions more in federal appropriations to boost programs that fight, treat, and stop substance abuse and support access to mental health services. These efforts culminated in the signing into law of the SUPPORT Act in the last Congress. In my home state of Oregon, we've seen the results, a 3.1% reduction in opioid deaths based on the most recent statistics from the CDC. I'm pleased we have continued to work together in this space. It's important, including by continuing our work on fentanyl, and with this important hearing today examining how the states are utilizing the funding and the authorities provided by Congress. But there's so much more we could do together. Earlier this year, Energy and Commerce Republicans published a request for information about the substance use disorder treatment industry. The RFI built off the patient brokering investigation that we conducted in the last Congress, and this investigation brought us to the question of what is good treatment, and conversely, what is bad treatment, which is the central question posed by our RFI. With the billions of dollars we're sending into the states for prevention and treatment, we need answers. Just yesterday, Energy and Commerce Republicans sent a letter to the 3 opioid manufacturers we began investigating together last Congress, asking them to complete production to our requests. It's critical we fully understand the causes of the opioid epidemic in order to ensure that our solutions are the right ones, and it's important that they answer our questions. We should also hold a comprehensive series of hearings to conduct oversight of the implementation of the SUPPORT Act. For example, relevant to today's hearing, the SUPPORT Act included the INFO Act, sponsored by Mr. Latta, which calls for the creation of a public and easily acceptable electronic dashboard linking to all the nationwide efforts and strategies to combat the opioid crisis. The INFO Act was designed to meet a specific need of local stakeholders who were telling us that despite Congress having devoted record numbers of federal dollars to combat the opioid crisis, they had trouble finding what resources were available and where they were. This is certainly an issue we heard a lot about from Mr. McKinley and others. This provision is absolutely critical in helping those on the front lines of the opioid crisis, but I'm really concerned about its slow implementation. In addition to oversight of the SUPPORT Act, we also need to begin working on the next wave of legislation to address not only the opioid crisis, but also substance use disorders more broadly. Most urgently, we need to reauthorize the fentanyl ban, which is set to expire in a matter of weeks. Reauthorizing the prohibitions on various forms of fentanyl has broad bipartisan support. We should do that expeditiously. And today's hearing is an important step, though, to understand the impact that federal grant dollars are having on states. I want to thank all of our witnesses for being here and being part of this equation, and I look forward to hearing from you. With that, I'd yield the balance of my time to the ranking member on the Subcommittee on Health, Mr. Burgess.